Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating and rare case, nasal blastomycosis in a cat. This case, documented by Timothy Andrew Bolton, Emily Green, and Thomas Ciceri, highlights the importance of considering blastomycosis in the differential diagnosis for feline nasal disease, especially in endemic areas. Our story begins with a 5-year-old castrated male domestic long-hair cat. This feline, a barn cat from rural West Virginia, presented with a 3-week history of left-sided facial swelling and epistaxis, or nosebleeds. Despite prior treatment, including a tooth extraction and clindamycin administration, the cat's condition persisted. On examination, the cat exhibited significant soft tissue swelling originating at the left nasal bridge and extending along the left side of the face, terminating in the left submandibular region. The left submandibular salivary gland was also enlarged, and the cat presented stertorous breathing. Initial blood work revealed mild anemia and hyperglobulinemia. Thoracic radiographs showed tracheobronchial lymphadenomegaly. Computed tomography of the head revealed a mass within the left nasal cavity and multifocal regions of osteolysis along the left sinonasal margin. Biopsies of the nasal cavity lesion and aspirates of the facial swelling were obtained for further analysis. Histopathology revealed pyogranulomatous inflammation containing yeasts of 2 different morphologies. The smaller yeast form, measuring 10 to 15 micrometers in diameter, displayed a thick, double-contoured cell wall and broad-based budding, characteristics of Blastomyces dermatitidis. A larger yeast form, 30 to 40 micrometers in diameter, was also observed, resembling Coccidioides immitis. Cytological examination of samples from the nasal bridge and submandibular swelling confirmed the presence of the smaller yeast form. To differentiate between a single or mixed organism infection, a Blastomyces urine antigen test and Coccidioides serology were performed. The Blastomyces antigen test was positive, while the Coccidioides serology was negative, confirming a diagnosis of pyogranulomatous rhinitis secondary to blastomycosis. Blastomycosis is a systemic infection caused by the fungus Blastomyces dermatitidis. It is endemic in the United States, particularly east of the Missouri River, including the Ohio and Mississippi River valleys, the Great Lakes region, and the East Coast. Infection typically occurs through inhalation of spores, leading to primary lung involvement or dissemination to other organs. Feline blastomycosis is rare compared to canine cases. Clinical signs often involve the respiratory tract, but primarily the lower respiratory tract. Upper respiratory tract involvement, such as in the nasal cavity, is even less common. In fact, the authors were aware of only 2 previously reported cases of confirmed feline nasal blastomycosis. Following the diagnosis, the cat was treated with Itraconazole at a dose of 10 milligrams per kilogram orally every 24 hours. Within 3 weeks, all clinical signs had resolved, except for mild soft tissue swelling in the left submandibular region. Follow-up Blastomyces urine antigen tests showed decreasing levels, eventually becoming negative after 8 months, at which point Itraconazole treatment was discontinued. The cat remained free of clinical signs and was transitioned to an indoor lifestyle. Cytological examination of tissue lesions is crucial for diagnosing blastomycosis, as the organism exhibits distinctive morphologic features. The characteristic B, dermatitidis yeast, is 10 to 15 micrometers in diameter, with a thick, double-contoured cell wall and broad-based budding. In rare cases, a giant yeast form, measuring 30 to 40 micrometers in diameter, can be observed, potentially resembling Coccidioides immitis. In this case, the presence of both typical and giant yeast forms initially raised suspicion for a mixed infection. However, the negative Coccidioides serology and lack of travel history to a Coccidioides endemic region suggested that the larger yeast organisms were likely giant B. dermatitidis. Differentiating between coccidioidomycosis and blastomycosis is vital due to differences in treatment protocols. Itraconazole therapy, consistent with blastomycosis treatment recommendations, was effective in this case. The Blastomyces quantitative urine antigen enzyme immunoassay, EIA, is a valuable tool for diagnosing blastomycosis. While its diagnostic sensitivity and specificity in cats have not been extensively studied, it can be positive in confirmed cases. In dogs, the Blastomyces antigen EIA exhibits high sensitivity for detecting active disease and monitoring treatment response. In the present case, urine antigen levels correlated with clinical improvement and treatment success. Bony lesions are reported in approximately 15% of canine blastomycosis cases. The prevalence in cats is unknown, but the osteolytic appearance of the skull bones in this case is similar to that reported in dogs. This case underscores the importance of considering fungal rhinitis, including blastomycosis, in cats with invasive nasal cavity signs such as epistaxis or facial deformity, especially in endemic areas. While neoplasia is a more common cause of chronic nasal discharge in cats, the potential for a favorable outcome with antifungal treatment makes blastomycosis a critical differential. Radiographic signs of lower respiratory tract disease are common in feline blastomycosis. Although this cat had tracheobronchial lymphadenomegaly on radiographs, it lacked clinical signs of lower respiratory tract disease. This highlights the limitations of radiographic imaging in accurately assessing the extent of lower respiratory tract involvement. The route of infection in this case remains uncertain. While dissemination from a primary pulmonary infection is possible, direct spore inhalation or inoculation into the nose cannot be ruled out. The Itraconazole dose used in this cat was higher than necessary. Vigilant monitoring for adverse effects, such as anorexia, vomiting, and hepatotoxicity, is essential when using higher doses. In conclusion, this case report highlights a successful outcome in a cat with nasal blastomycosis treated with itraconazole. It emphasizes the importance of considering blastomycosis in the differential diagnosis of feline nasal disease, particularly in endemic regions. Furthermore, it showcases the utility of Blastomyces urine antigen testing for monitoring treatment response and guiding treatment discontinuation decisions. Finally, it raises awareness of the giant yeast form of Blastomyces, which can be mistaken for Coccidioides. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.